But let's talk about probably the most serious complication of all, which is the Glans ischemia. You mentioned a little bit before. What type of patient do you have to have a high suspicion that it might happen, or is it something that might happen because of pure technique? Is it something just that the patient, because of poor vascular flow or conditions, is he more prone for that?
I mean, fortunately for me, before I started practice, Steve Wilson and a group of other surgeons, they wrote this article back in 2017, and they were looking specifically at what were the preoperative risk factors and what were the intraoperative risk factors for developing Glans ischemia. I've only seen one in my patient cohort, and the guy had all the risk factors. So I wasn't surprised when it happened, and I'll tell you how I managed it. But before that, but what you were talking about, what are the risk factors? Again, a chronic smoker, a guy who smokes 2 packs a day, he's also diabetic, and you had to do a degloving incision for Peyronie's disease, and you had to do a complex reconstruction, for that Peyronie's disease. Again, that's a guy who is at extremely high risk of developing Glans ischemia. So again, make sure that if you have a guy who's, a chronic smoker, try to get them to at least quit for several weeks, or at least tone it down, or at least those first few days, don't smoke. Because again, it can be difficult to reverse it once it starts developing, right? In terms of my patient, I mean, I'll tell you the story with my patient. He was a chronic smoker. He wasn't diabetic, fortunately, but he was a chronic smoker, and he had really bad Peyronie's, 90-degree curvature, and I had to do multiple incisions, like I described, to fix his Peyronie's. I did not do a degloving incision, fortunately, but the guy, I will never forget. I mean, that was early on when I was in practice, and the guy, I used to admit my patients post-op. And post-op day number 1, I go in to round on this guy, and the guy's nowhere to be found. The guy was outside smoking. So I'm like, dude, I mean, you cannot smoke. I mean, you had a really, high risk surgery. You have to avoid that. The guy was doing well. 1 week later, again, this was 1 week, not several days. And again, usually for my patients, I tell them, hey, send me a picture of the glands. For all my Peyronie's patients, I have them send them pictures of their glands in the first 48 hours, because most of the time you will start seeing changes in the first 48 hours. This guy was doing well, but 1 week after his surgery, he called me. He said, hey, doc, my glands feels very, very cold. And I'm like, uh-oh, red flag, right? I tell him, it's like, hey, send me a picture. And it looked kind of dusky. It already looked kind of dusky. It was a little bit grayish. So what I started doing for that guy, I started him on daily Cialis right away to start bringing some blood flow into his glands. And then several days later, this was the day that I was in Dallas preparing for my oral boards. I received a call with a picture. He said, hey, doc, look at my penis. And he, hold and behold, he had ischemic changes in his glands. Fortunately, they were just patches. And I told him, go to the emergency room right away. I called my partner. It's like, hey, man, I have this guy, please go in and see him. And I can even show you the pictures. His entire ventral incision was black, like
Wow.
black. And then the glands, he just had like, a few spots, but they looked very, very superficial. The rest of the glands looked nice and pink and healthy. So I kept him in the hospital. I deflated the implant, all the way. And I told him, hey, man, what we should do is take this implant out, but we can, risk it and see how you do. Because again, it looked very superficial, and it was already calcified. I mean, he had like a dark, eschar. It was already dry. It wasn't
Wow.
wet. So he had like a dry gangrene right at the top of the gland. So I told him, like, hey, man, let's see how you do. I started him on every other day. He was taking 20 milligrams of Cialis for like 3 weeks. And the guy ended up doing well. Those scabs, they fell off.
So you never had to remove the implant?
I never had to remove the implant.
Wow.